Hey everybody, it is Jared Wade, Communications Director for the town of Avon, and I am here with my friend John. John's going to tell you a little bit about himself and the organization that he is with. John and I met at the, I think, Avon Chamber.
I believe that's right.
Yeah, we were walking around and we met each other and started talking about some neat things that they do, as well as what's going on in Avon. But, I could talk about John all day long, but let's start off. John, introduce yourself. Tell everybody who
Sure.
you are, the company that you're with. Just a real quick, who is John?
All right. My name is John Mollaun. I'm the Executive Director at Hope Healthcare Services in Avon. Worked in Hendricks County my whole career. I worked for 26 years for what was Public Service Indiana, PSI Energy, Synergy, Duke Energy. 4 companies, 1 chair. But
all of the energies. If there's energy in the title, you were there at some point
that was
in time.
it.
All right.
Plainfield. So, so then made a transition in 2007 to Hope Healthcare Services. At the time, it was called Kingsway Community Care Center. And been there ever since.
All right, so Hope Healthcare Services. Some of you might be familiar with Hope Healthcare Services. Some of you might not be familiar with that organization and the services that they offer. And that's why we're doing this chat. That's why we're having this live at lunch today, is what they offer is really, really neat and really cool. And that's why I think John and I were like, we got to tell the community about this. We need to tell more people about these services that are available. So let's start off with the first big question. Hope Healthcare Services. Who are you? Who exactly is Hope Healthcare Services?
Oh, very good. We're a 501c3 not-for-profit.
Mm-hmm.
We have a single location. It's in Avon at 107 Park Place Boulevard, and we are a medical and dental clinic for people without insurance. Now includes things like mental health services. So we started with an all-volunteer as far as practitioners. We did have some staff for administration and myself for things like fundraising, but we now have actually added some paid staff members as well, paid licensed professionals to treat patients. So currently, with volunteers and staff, we have a kidney specialist. I would use the word nephrologist, but most people wouldn't know what that means, and I wouldn't either probably about 3 months ago. So
I know what that means, but if anybody else doesn't,
lay people out
exactly.
There, and we have a urologist. We have a neurologist, brain.
Oh wow.
We have 2 pediatricians. We have a dietitian. We have women's services. Let's see, I think I hit all those. And then just general family practice medicine, primary care. We have a physical therapist as well.
Oh, wow.
Now, some of those are staff, some of those are volunteers, but the key is they're all serving there.
Mm-hmm.
So it's a mix of both. On the dental side, we do cleanings, fillings, extractions, root canals, denture work, crowns.
Mm-hmm.
So really a full range there as well. We have a staff dentist 1 day a week, and then we have volunteers as well. We have a nurse practitioner who serves, that's the staff on Mondays all day, like 9 to 5, I'm sorry. And then we are seeking a second, either nurse practitioner or physician's assistant for 1 day a week.
Okay.
We had 2 days a week, and one of our staff members left us for a full-time gig, which is completely understandable. And we're looking for a second dentist as well, to have dentistry 2 days a week. With the staff, a full day. And then again, our volunteers work different shifts.
So out of the services that you offer, is dentistry one of the primary ones? Is that one that brings in, I hate to use the word service, but is that one of the biggest services that you offer? Or
probably it's one of the biggest needs.
Okay.
The other thing we have is mental health counseling. Now, they're not staff members, but we've developed relationships with what is now 5 different mental health counselors, 3 of which are based in our building. In other words, they see patients in our building.
Okay.
So they rent space from us. They can see their own patients, but they see our patients at a reduced rate, and we also subsidize that. Our fee, none of our services are free.
Okay.
But they are ridiculously low. You could see a specialist for $10.
Oh wow.
Yeah.
That's quite lower than what I thought. That's like, how do you get that how does that happen?
Well, 2 things. Some of those are volunteers.
Oh, sure.
And secondly, I fundraise. About 15% of our revenue comes from the patients. The rest is raised from
Okay.
foundations, from businesses, from churches, from individuals, from special events, kind of an all of the above approach. But yeah, so we have a variety of services. The probably the other thing, dental services are a little more expensive. Dentistry is expensive.
Mm.
They need lots of tools and lots of equipment and lots of X-ray stuff. But no, so in addition to mental health, we also have someone that serves as a social worker.
Okay.
And our patient criteria is pretty simple. If you don't have insurance of any kind, and that means no VA, no private medical, no private dental, no Medicare, no Medicaid. If you have no insurance whatsoever, you can be seen at Hope Healthcare. There's no geographic restrictions. There's nothing like that.
Oh, wow.
And we've tried to accommodate as many people as possible. We have a translation service, that we can, translate pretty much any language. We've got, access to radiology and labs at a greatly reduced rate for patients. And really, I have two things. We always want to make people aware. Obviously, people don't come to us because they're not aware we're there.
Sure.
But the patients we serve are not the poor, so to speak.
Mm-hmm.
And the reason I say that is if you're below the poverty level in Indiana, you should be on the Healthy Indiana program. And we'll help you sign up for that if you're not aware of how to do that. That program is provided for you. It's very low cost. And so we're serving people that are falling in that gap of they're out working, and so they make too much to qualify for some government assistance programs. However, if you've priced private medical insurance,
I think we all price private medical insurance at some point in time.
So people are falling through the cracks. They're paying for their housing, they're paying for their utilities, they're paying for food. Things are going up. Mm-hmm. They're paying for their transportation. They're paying for childcare. And so, when push comes to shove, you're going to keep the roof over your head. You're going to keep eating. You're going to keep your transportation so you can keep your job. You're going to keep your childcare so you can keep your job. And so the one that goes by the wayside is health insurance. And the thought is, I'm fine. I feel okay. And my message to you is that's great. But if you don't, so you've dropped insurance. I'm not encouraging dropping insurance. As I said, we'll help you if you qualify for programs. However, two things. We're there for you. Number two, come in. If you're uninsured, come in. We had a patient yesterday who just don't know how to say it. We found this 4 or 5 times recently. They came in when they had advanced stages of very significant health problems.
Sure.
That could be fatal. That's not what we want. If you feel great, that's good. Yeah. But do you know what your A1C is, your blood sugar level? You may be a diabetic. What is your blood pressure? Our doctors are great doctors. Many of them, they're hospitalists that, come after work at the hospitals that you're seeing there.
Yeah.
They're fantastic doctors. They've won many awards, quite honestly. These are some tremendous doctors. So come in and get checked up. I know you feel great. That's good. But for a $30 office visit, and then if you need to see a specialist, wow, we're going to charge you $10. And we can get your labs done and everything. And for such a low cost.
It sounds like a theme that Hope Healthcare Services has is just don't wait.
Yes, don't wait.
There's a lot of times that I think a lot of the community, and I'm not going to speak for everybody, but I'll speak for myself. There are times that, I want to do something, but I don't feel that I'm able to afford it, or Absolutely. I can't make it happen. And we're all human. We're human. There's a level of pressure that we put upon ourselves where we're like, if we can't do this, then I don't want to rely on somebody else.
Right.
Because of any number of factors of we don't want to look bad in front of our husband or in front of our wife or in front of our kids. And it kind of boils down to that judgment. We don't want to be judged. We don't want people to judge us. And it feels, and I'm not going to speak on behalf, but it feels like this is very much a judgment-free service.
Absolutely.
You come in, you tell us what you need, you tell us what's going on, and we want to take care of you, and we want to make sure that you are living the best life that you possibly can live while, focusing those skills from the doctors and the multiple different medical professions that you said that I can't remember, to be really honest, because they're fantastic individuals. But it sounds fantastic that you're going to be able, and that you do provide these services in an atmosphere of compassion
Absolutely.
and just wanting to make sure that they take care. That's a great lead in into a big question that I love, which is why. Why do you do this? Why do you have this? This is a big question. I told John before we started up, I said, I'm going to ask you why you do this. And I'm going to make sure that you understand that that's going to be the big question that we talk about. But I also want you to know, if you're sitting at your office right now, if you're sitting at home and you're watching this live, or if you're watching this after the fact and you have questions, at the very end, John's going to share contact information for himself as well as for Hope Healthcare Services. But feel free to comment in the comments below if you're watching on YouTube
Absolutely.
or Twitter or Facebook. And we'll make sure that we get those questions answered correctly. And if that means that we just got to shoot an email over to John and say, hey, there's a few questions that are
Sure.
out there, I'm sure that they're going to respond back out to you as well. So don't forget, you can always ask those questions and we'll get them answered as quickly as possible. So John, the why, why was this service created? I know that it's been in some transition and it's changed over the years. Is the why from the beginning the same as the why that you have now? Has that evolved, which is a very natural thing? Give us the lowdown on why you all do what you do.
Yeah, sure. Well, it started in June of 2005 as a ministry of Kingsway Christian Church. So the church really had the vision for this. And again, opened the doors in 2005 and has grown quite a bit with a number of volunteers that have come, the budget, the staff. Like I said, we went from all volunteer to where we do have staff practitioners now as well. But our goal was always to treat people holistically, as body, mind, and spirit. We have mental health counselors now, which we didn't have. We've got medical and dental, and so many of those are interrelated. We just had a patient recently who really benefited from two things, the dental and the mental health. The dental, because he was so self-conscious of his teeth, the front teeth that were visible. So there's that, overriding thing of, I can't look people in the eye, I'm hiding, that part of me. And we've seen dentures just radically change for people, their self-image. And then that and some counseling together. Not only have our doctors talked about it, but his family has talked about how different a person he is from the time he walked in our doors with those two services. And again, they're working together, physically looking at the self-image and then also dealing with that self-image, that self-talk that he might have. But from the beginning, it was a Christian ministry. Again, you do not need to be a professing Christian to come to Hope Healthcare Services. We have people of all faiths and no faith that come to us. But do understand that the volunteers are motivated by a commitment to the kingdom of God. And it's a way for them to serve and to show their love for someone else. Again, it amazes me every day, the people that show up and volunteer at Hope Healthcare. I'm humbled by the fact that the way they come and serve. It's much more, obviously we're not paying them. So they're getting their satisfaction from just the service that they're providing.
Yeah.
And so, they're motivated by the love of Christ to give back and to just share that love in a tangible way with people in the community.
It's neat just to hear about an organization like this within Avon that is wanting to give back to the community as a whole, but the county and even further than that, because you mentioned you don't have to be an Avon resident.
No,
you can come from wherever. If you're in Brownsburg, if you're in Indianapolis, they're here to serve anybody that is watching this right now. You are welcome to come, and they will help you to the best of their abilities. And if there's something that they can't do, I would presume that they will be helpful to help you figure out where you need to go or who's going to be able to help you.
We really shine in that area. The Indiana Rural Health Association rents a space in our building to help sign people up on various programs, including the Healthy Indiana program. Well, once a week, they have an employee that is in our building helping people sign up on HIP or connect them to any other resources. She has a great social work background. And again, not staff, but it's a way we partner with other organizations. So we partnered with these mental health professionals. We partnered with the Indiana Rural Health Association. And then we've just got some great partners in the community. So the communities come around us in a powerful way. And we're very grateful for that. So, I'd love to take credit for everything that goes on with Hope Healthcare, but that would be ridiculous. I tell you the story and you go, what did you have to do with that? And the answer would be nothing. So
It's an honest answer.
Yeah,
It's a
that's
very
right.
honest answer.
So
So John, as we wrap up here,
Sure.
contact information. What's the best way for anybody that's watching right now to contact you directly or Hope Healthcare Services? Where would they need to go?
Well, my email is jpm, P as in Paul, M as in mother, jpm at myhopehealth.org.
Okay.
And myhopehealth.org is the website address. But probably the best way to always get a hold of us is our phone number, which is 317 272 0708. And leave a message if we don't answer. We're not always there on Fridays. We don't work on the weekends. Fridays, we just don't have a lot of volunteers that have come. But our hours change. Our hours change, and our specialties can change with a new volunteer that walks in the door. Because then they pick their shift, and we do have some volunteers that have chosen Friday. So it varies. To give you our hours would just be this scattershot schedule, because we also have some evening shifts. Doctors are coming, and dentists are coming after their work at their practice or at the hospital. So we have evening shifts, we have morning shifts, we have afternoon shifts. Again, we've got some consistent shifts with staff. But the best way is always that phone number. Leave a message. We will call you back and get you in. And like I said, I can't encourage that enough. Please pass it on to anyone you know that doesn't have insurance, and not just tell them about us, but tell them to come. Again, it just breaks my heart to see someone who, had we caught something early, could have prevented some very serious conditions and maybe even saved a life.
Yeah, no, absolutely. I mean, it doesn't get any more clear than that. If you're watching this and you don't necessarily need the services that they have, that's okay. You can share this video. You can share the contact information that John has provided, because there might be somebody in your Facebook feed. There might be somebody who lives right down the street from you that they need some help, but maybe they're just a bit timid to reach out and to ask for that help. You can be that person to help them reach out and help make that connection happen. So share it, not necessarily for the town of Avon, but we encourage you to share it so that way the individuals that you know and that you care about, all of your friends on Facebook, all of your friends in real life, and everybody that's in between, they're going to be able to reach out and get the services and the help that they need.
No, I appreciate that comment, because there is maybe a stigma to going to the charity clinic. But, we've gone to electronic dental records. We've got electronic medical records. We've got, digital x-rays. We've got a digital panoramic x-ray machine on the dental side. I mean, we have really invested in equipment as well as the personnel to, I won't say, we don't have the same equipment maybe as the hospitals here in the county, but we certainly provide quality healthcare at a low cost. So if there's a stigma there, and the other thing is, many people don't think about themselves in that term, because as you said, they're not poor. These are working people. They're self-employed. I read a stat the other day. It may be old now, but it came from the Economic Development Partnership here in the county, that 59% of the businesses have 4 or less employees.
Oh, wow. Yeah.
70% of the businesses had 9 or less employees a few years ago.
Wow.
Now, that doesn't mean all those people are uninsured, but their employer is not required to provide insurance for them. So they're finding it on the open market, or they're falling through the cracks. And so, just as you pointed out, you don't necessarily know who doesn't have insurance. And I'll be in a meeting, like a chamber meeting like that, and I'll make that statement. I'll say, you'd be surprised who doesn't have insurance. We'll have that conversation, and there's 2 or 3 people standing around. Well, later, one of the 2 or 3 people will come up to me afterwards and say, I don't have insurance. But again, they didn't say it in front of the other 2 or 3 people.
Yeah.
Because of, like you said, that stigma. Well, again, we understand that people falling through the cracks are falling through the cracks because they're working hard, because they're starting a business, because they're doing what it takes to keep themselves, solvent, and yet not dependent on governmental programs that they don't qualify for.
Yeah.
So absolutely, you don't know who that person is. Their family broke up, and one of them had insurance, and now the other one doesn't. So there's 1,000 different scenarios on why someone is, but it's not the person that you would expect, so to speak.
Yep. No, John, thank you, my friend.
Thank you so much.
We've been trying to plan this for a while, so I'm glad that we were able to make this happen. We had construction happening in here for a couple months, and I'm glad to be able to have you in here. If you have questions for John, if you have questions for Hope Healthcare Services, reach out. I'll try to put some contact information in the comments below so that way you have easy access to that. Other than that, enjoy the rest of your week. Don't forget, if you're watching this live now, the Greater Avon Job Fair is coming up on this Saturday. Hopefully we will see you there. If you have any questions for the town, feel free to reach out and let me know, and I'll connect you to the right person.
Great.
Words are struggling today for some reason for me. All right, my friends, I'll see you soon. Bye-bye.
Great. Thank you.